Hey everyone, my name is Megan Dooley. I'm an occupational therapist, and I am here today to talk about caring for somebody with dementia and having a good toileting routine with them to help reduce incontinence and frustration for the individual with dementia and also the caregivers. So the first thing, again, as I talk about in every video, is really analyzing the individual's physical abilities to get to the bathroom, to be able to pull their pants up and down, get up and down from the toilet, reach the toilet paper, all of those things that are involved with the toileting task. The second thing you want to look at is the individual's ability to understand toileting. What are the components of it? Where is the toilet? Where's the bathroom? How do they get there? And then the third thing is, if they are not able to do that with your current environment, with how your bathroom is set up, the location of your bathroom, then you want to look at modifying that environment or the assistance that your loved one is receiving to be able to be successful in toileting and maintaining as much continence as possible. So the first thing that you really want to look at are not using too many incontinence pads, Depends, things like that, for as long as possible, or trying to really determine when it is absolutely necessary to use those. This is because there can be a high rate of skin breakdown seen on your loved one if they're sitting in a wet Depends or they're sleeping in that. Some better options at times would be for males an external catheter, putting them on an actual like rubber sheet or some sort of an incontinence pad that you could get and have them sleeping without, undergarments. And this allows that to soak into a different material than their skin just being on that. But when they're awake during the day, one of the best options is to get them on a toileting schedule. The recommended toileting schedule is every 2 hours. However, if you are the caregiver of somebody with dementia and you've been around them for a long time, they may have developed, prior to having dementia, a pretty typical toileting routine that you can follow. If it's early stages, you can start setting that up. If it's late stages and you're starting to see a lot of incontinent episodes, you can really start to track when they're incontinent. If it's in the morning after breakfast, if it's in the evening, if it's overnight, if it's when they're laying down to take a rest. Track those, but also I really recommend that you start with the 2-hour toileting, and then you can kind of taper that as it suits for them. So if they aren't wet or having to toilet every 2 hours, you may be able to expand that out more, and then ensure that you're taking them to the toilet during those high times of incontinence. Okay, so that is the number one thing, besides putting them into Depends or some sort of an absorbent pad, is to get onto a toileting schedule. With the toileting, it is helpful if the individual is in clothing that is easy to manage, not a lot of buttons or zippers. Some people love to wear the belts and the slacks and all of those things. That can make it difficult for them to toilet independently as long as possible, as well as for a caregiver to manage all of that when there is urgency with having to toilet. So if you can, put them into more comfortable clothing or reduce the amount of things that you have to undo to be able to toilet, that may be helpful. The other thing for the environment is to ensure that there's a kind of like a beacon directing them to that toilet. These can be things in the early stages of just not having a lot of clutter. We talked about that with bathing, not a lot of things in the bathroom. If you need to cover up waste paper baskets, storage containers, putting grooming items into the cabinets as opposed to out on the sink, that will really help guide them to the toilet. You can also change the toilet seat cover Make it a brighter, more contrasting color than white, especially if you have lighter colored walls or lighter flooring. It may be very difficult for that individual to locate the toilet. Some people even take the back lid of the toilet seat completely off so that that toilet seat is never closed. So if the individual gets into the bathroom and they can see the water and the toilet much easier than if it's shut down and now it kind of looks like another chair or a sitting area. The reason that you want to cover waste paper baskets, laundry baskets, if you have them in there, is you don't want that individual to confuse the toilet as that laundry basket, as that waste paper basket. I've known individuals who have urinated in or had a bowel movement in the bathtub, actually in the sink. So there are things that can confuse them. They may find the bathroom and then not know where they should actually be going. The other thing that you want to do is make sure that around your toilet that everything is easily accessible. If they're using wipes, like flushable wipes or the toilet paper, make sure that it's within a reachable perimeter. So not further out than your elbows on both sides. And then in front of you. So sometimes we have portable toilet paper holders that are kind of a long ways. They're way out in front of the toilet or kind of a full arm length away to the side. If that's the case, you may want to get a portable one to put it closer to them for more visual and easier for them to reach. The other thing is putting up signs that signify or identify it as the toilet. It may be one individual sitting on the toilet. It may be a picture of the toilet to really help that person identify where they should be. You don't want it to get too confusing. Okay, so, I previously showed some different signage that you can use for things. The steps of toileting or pictures of toileting, how that works. The other thing that can often happen is if your bathroom is in a hallway that has a lot of doors to bedrooms, to closets, you may want to shut the other doors and then leave the door to the bathroom open so that that individual isn't confused about where that is. It's a very welcoming situation. You can put arrows on your wall as the disease progresses and you start noticing that they're having a hard time finding the bathroom. Signs on the door, signs right outside the door. If you're going to leave the door open, you can put a nice sign on the wall right outside of it or on the top of the door frame that signifies it's the toilet. You also want to have safety measures put in place. So getting to the bathroom, are there grab bars for them? Can they get their wheelchair in there if they're in a wheelchair? How are they able to get to that toilet? So if they're in a hurry, what does that look like? The other thing that you want to really look at, the 2-hour toileting, but also how do you communicate toileting to that individual? It's hard at times for people to recognize maybe when that person has progressed or changed in the course of their dementia. So, typically I can tell you, I don't need to go to the bathroom right now, or I kind of need to go, but I could wait. It may be difficult for you to identify when your loved one has progressed to a point that they maybe don't feel the same that they used to when needing to void, but also that their memory may change so quickly that they may say 1 minute, no, I don't need to toilet, I don't have that feeling. And then, 5 minutes later, they tell you they have to go to the bathroom, which can frustrate you as a caregiver because you're like, I just asked them and they said they didn't have to go. They probably didn't have to go, or they don't feel the urge the same until it's a full urge and I'm going to go right now. So having that toileting schedule and not asking as the disease has progressed, that moderate dementia, or when you start noticing a lot of incontinent episodes, just say, hey, we're going to go to the bathroom, then we're going to have lunch, or we're going to go to the bathroom and then, lay down. When you're in the bathroom, you want to make sure that you're communicating very clearly. Don't give more than one step. Tell them, pull your pants down, allow them time to pull their pants down, then tell them to sit down. So it's a very methodical, step-by-step direction, because if you tell them, pull your pants down, sit down, they may just sit down and miss the pulling the pants down. This is, of course, if they're able to do those tasks. If you're having to physically assist them, because they haven't been able to be mobile or physically able to toilet for a long time, or because of the disease, they're losing some of that physical abilities to physically manage their pants and the steps, but also cognitively knowing how to assist them, but show them before you're going to do that. I'm going to pull your pants down like this, and I'm going to have you sit on this toilet. So give them that visual demonstration along with a verbal, so that they don't feel overwhelmed with somebody who's, now pulling their pants down. If you have caregivers providing this, like paid caregivers or people coming into the home, make sure that they have that step-by-step process down as well, that it's clear, it's simple, it's one step at a time. And then also reminding them to introduce themselves every time that they are coming in contact with your loved one, because they may forget who that is, and it just can also cause anxiety and fear with some of those more intimate tasks like toileting or bathing. The other thing that you can do if you're noticing that there's high, amounts of incontinence at night, in the evening, you can talk to your physician or nutritionist and talk about, what is the amount of fluids that your loved one should be getting to deter dehydration or anything like that, but also sometimes tapering some of those liquids and foods after a certain amount of time at night, so that you can take them to the bathroom before bed and maybe reduce the risk or the amount of incontinence that is occurring while they're sleeping. But you really want to identify, how much should they be taking in fluids and food, and then talking about a time that may best suit to eliminate some of that. And that's completely okay. We do that for ourselves, so we don't have to get up and toilet in the middle of the night. We do that for kids at times, like don't give them a bunch of pop or juice right before bed, because then we're having to get up often. If you're encouraging them to go to the bathroom, if they're walking but they're having difficulties with that task, or they're trying to transfer onto the toilet, don't be talking to them during those moments of high concentration. So if you're asking them to pull their pants down, as much as you want to interact with them, don't be talking about the next step or the day or what you're going to do that day, because for some individuals with dementia, it takes all of their mind power to focus on that one task in that moment. And if we start distracting them while they're moving, standing up or sitting down, it can increase their risk for falls, and frustration, anxiety, those type of things. So just know that if you're asking them to do that, just give them their full attention to that physical task, and then you can begin that conversation or talking to them after they're safely seated on the toilet, in their wheelchair, back in their recliner, anything like that. Remember to use positive reinforcement with them. Initially, if you start doing this and that individual is in that early to middle stages of Alzheimer's, they may get frustrated with you when you first start trying to have that toileting schedule with them. Praise them, thank them. They also are going to have moments of embarrassment when they're incontinent, and that can increase frustration with each other, with themselves. They can feel ashamed because they really didn't feel like they had to go 2 minutes ago, and now they're going. They have to go and they can't get their pants down, and they have an accident, and they may become frustrated with you because you're not going fast enough, not getting them to the bathroom. That's just a high stressful situation that you really want to avoid, because it could injure you as the caregiver trying to hurry up and get them on the toilet. And it can also just cause a lot of discourse between you and your loved one when they are ashamed that they had an accident. They're upset that this happened, but they're also, wanting to tell you to go faster. You should have done it differently, or you don't need to lock the brakes. Just get me on the toilet. So that scheduled time, it helps to use a timer. Everybody's very busy, and you can get caught up as the caregiver or your loved one in a book or doing laundry, shoveling snow. And then you realize, oh gosh, I missed that time. And you're putting all of that energy on yourself to remember every 2 hours, I got to take that loved one to the bathroom. Just set a timer for every day of the week. every 2 hours, or if you determine, 2.5 hours works, and then before, rests or bed, it may be an increase in needing to go. And that way it just goes off. And that also deters your loved one from feeling like you're nagging them. We just all come to know, okay, the timer went off. Oh, time to go to the bathroom, see if we can go, and then back to your day. If you're having difficulties with, UTIs or difficulties with bowel movements, talk to your physician about that and changing diets, or maybe getting some additional supplements in. That can also be something that can be very frustrating for your loved one as the disease progresses and they're not understanding, why there's this urgency. They're not understanding why there might be pain with urination, or they're sitting on the toilet for hours on end because they have difficulties with constipation and not being able to go. So this is definitely an area that, it includes a whole team to successfully have a toileting schedule, but also to make sure that your loved one isn't having discomfort from the inability to not be able to go or having to go too much. So make sure that you reach out to them if you're noticing changes in toileting or in frequency of accidents, the smell of the urine, anything like that. Contact your physician and get your loved one in to get that looked at. It can be as simple as a change in medication that can cause some of these, or a UTI, kidney infection, those type of things that can cause these issues to arise and really cause a lot of stress for the loved one with dementia and also you as the caregiver. If you have any questions or things that you've noticed with your loved one, my information is in the bottom in the link below the video. Please feel free to reach out. You can talk through that with me. If you reach out, I can send you example toileting schedules that work and kind of help you as the caregiver navigate where you're seeing the majority of incontinence and what times of the day maybe are okay to maybe extend out that toileting schedule, and some different ideas to help promote less incontinent episodes. So as always, you as the caregiver, we appreciate all that you do for your loved one. You're cared about, and I hope you're having a great day.